Hi, my name's Cathy Elliott and I'm Chair of NHS West Yorkshire ICB and I'm Deputy Chair of our Health and Care Partnership. And my leadership message is about change. I fully appreciate that all staff within the ICB are feeling concerned and anxious at the moment as we go through organisational change. And as you know, national announcements were made in mid-March this year for a number of changes and reforms within the NHS. It is, I'm sure, a feeling of uncertainty at this time. And I hope the blueprint that came out from NHS England recently has been helpful to you in giving you an idea about how our duties will grow or change as an integrated care board. I'm pleased that NHS England invited a number of ICB leaders from across the country to contribute to it, including Rob Webster, our Chief Exec. I also contributed alongside a few other leaders from across Northern Systems. What you have in that document obviously is around changes in transfer and duties. But what I also hope you can see is some hope. That there are a number of roles that we'll play in future as a strategic commissioner that we have worked on for many years in West Yorkshire around population health management, working to reduce health inequalities, making sure that we are engaging and involving local people and communities in our work, in the design and the implementation, and therefore coming together in being a strategic commissioner. Lastly, I wanted to share that this is my last leadership message before I move on to be Chief Exec of NHS Cheshire and Merseyside ICB. I move on this month. And I want to say it's been a privilege to be part of West Yorkshire Health and Care Partnership for 5 years now. I joined as chair of Bradford District Care. As part of that, I had the great opportunity to chair the committee in common for the systems, mental health, learning disability and autism's provider collaborative. And I then moved on to become chair of the ICB in late 2021. And we've gone through so many changes in bringing clinical commissioning groups into the ICB, responding to the previous government's requirements as well as the new government's requirements. But I think we've held on to our values and behaviours, and we've done a number of things that we should be incredibly proud of, whether that is the work I'm particularly pleased about that I've done with public health and the board on reducing health inequalities as a commissioner and a convener of our partnership, all striving together on equity and social justice. And that includes winning a national award for our Root Out Racism campaign a little while ago. So there are lots of fantastic things that I'm pleased to look back on. I've learnt a lot from you all. I've learnt a lot from the system, and I hope I have helped to support a number of you in some ways. So please keep in touch. I'm only over the Pennines. Rob and I will definitely keep in touch as new ICB Chief Exec colleagues. But I think there is value in working together across the north of England to serve our communities. So yes, please keep in touch. Take good care and thank you.